Recognizing warning signs of a stroke. Your health matters. First, let's briefly understand what a stroke is. A stroke occurs when there's a sudden interruption of blood flow to the brain, either due to a clot or a ruptured blood vessel. This can lead to brain damage and other serious complications. To help you remember the warning signs of a stroke, we use the acronym FAST. Let's break it down. F. Face drooping. F stands for face drooping. If you notice that one side of a person's face is drooping or numb, it could be a sign of a stroke. Ask them to smile to check for this. A-Armm Weakness. A stands for arm weakness. Ask the person to raise both arms. If one arm drifts downward or feels weak, this could be another sign of a stroke. S. Speech difficulty. S stands for speech difficulty. Listen carefully to the person's speech. Are their words slurred or difficult to understand? Can they repeat a simple sentence correctly? T. Time to call 911. T stands for time to call 911. If you observe any of these signs, even if they seem to improve, don't wait. Call 911 immediately. Time is critical when it comes to stroke treatment. Beyond the FAST acronym, there are other symptoms to watch for, such as sudden severe headache, trouble seeing in one or both eyes, dizziness, loss of balance or coordination, and difficulty swallowing. Risk factors. Stroke risk factors can be divided into two main categories: modifiable and non-modifiable. Modifiable risk factors are those that can be controlled or managed through lifestyle changes and medical interventions. Non-modifiable risk factors are factors that cannot be changed. Here's a breakdown of both. Non-modifiable stroke risk factors. Age. The risk of stroke increases significantly with age, especially after the age of 55. Gender. Men have a slightly higher risk of stroke than women, although more women die from strokes. Family history. If a close family member, such as a parent or sibling, has had a stroke, your risk may be higher. Race ethnicity. Some ethnic groups, including African Americans, Hispanics, and Asian Pacific Islanders, have a higher risk of stroke. Prior stroke, or TIA. Having experienced a previous stroke or a transient ischemic attack, TIA, often referred to as a mini-stroke, increases the risk of a subsequent stroke. Modifiable stroke. Risk factors: high blood pressure, hypertension. High blood pressure is the leading cause of stroke. Managing blood pressure through medication and lifestyle changes can reduce stroke risk. Smoking. Smoking damages blood vessels, increases the formation of blood clots, and raises the risk of stroke. Diabetes. Uncontrolled diabetes can damage blood vessels and increase the risk of stroke. High cholesterol, elevated cholesterol levels can lead to the buildup of plaque in arteries, increasing the risk of blockages and stroke. Obesity. Being significantly overweight can contribute to other stroke risk factors, such as high blood pressure and diabetes. Physical inactivity. A sedentary lifestyle increases the risk of obesity, hypertension, and other stroke risk factors. Unhealthy diet. A diet high in saturated fats, sodium, and processed foods can contribute to conditions like obesity and high blood pressure, increasing the risk of stroke. Excessive alcohol consumption. Drinking too much alcohol can raise blood pressure and contribute to other stroke risk factors. Drug abuse. The use of illicit drugs, especially cocaine and amphetamines, can significantly increase the risk of stroke. Atrial fibrillation. AFib. AFib is an irregular heartbeat that can lead to blood clots, increasing the risk of stroke. Other heart conditions. Certain heart conditions, such as heart valve disorders, congenital heart defects, and an enlarged heart, can increase stroke risk. Sleep apnea. Sleep apnea, characterized by interrupted breathing during sleep, has been linked to a higher risk of stroke. Migraines with aura. Individuals who experience migraines with visual disturbances, aura, may have a slightly increased risk of stroke. Prevention. Prevention is key. Leading a healthy lifestyle by maintaining a balanced diet, exercising regularly, and managing chronic conditions can significantly reduce your risk of having a stroke. Recognizing the warning signs of a stroke and acting quickly by calling 911 can make all the difference in someone's life. Time is the brain when it comes to strokes. Stay informed, stay vigilant, and let's work together to spread awareness about stroke prevention and early intervention. Thanks for watching. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more health-related content. Remember, your health matters, so take care and stay informed. See you in the next